Hey everyone, today's conversation is going to be very, very interesting. We're going to talk about social impact. We're going to talk a little bit about the billion innovations that are coming out of Europe. We're going to talk about, for example, and even my guest doesn't know this the second, but I want to talk a little bit about the clinical trial innovation that the EU has proposed and is sort of advocating for. He's working on some really interesting stuff, some stuff that isn't just focused on regular innovation where everyone wants to talk about the next greatest thing, but I think a really important part, which is how do you get all those next greatest things to work together? How do you build that ecosystem? So we have a really, really special guest with us today. He is a strategic thinker. He's looking to create social impact within Takeda and outside. He's the global head of integrated and personalized care at Takeda, and he's looking at the intersection of biology and technology. He's the founder of Curated Health, a not-for-profit platform aimed at spreading knowledge. And he's the author of Crossroad, 7 Pathways for a Better Future of Health in 2050. And that's going to be published on September 22nd. And our guest for today is Hicham Naim. Hicham, how are you?
I'm good, thank you. Thank you. How are
Thank
you, Darshan?
I'm doing good. Thank you for coming on. I do have to clarify, we're both pharmacists, but this is not clinical advice. I'm a lawyer. This is not legal advice. They're just things you should be considering. Please leave a comment, please share. Please feel free to ask our guests questions. You can always reach me on Twitter at Darshan Talks. Go to my website at darshantalks.com. However, you can also reach Hisham at a few different places because he's everywhere, just to be clear. You can go to hisham.naim at curate.health or go to his email at hisham.naim@takeda.com. He also has a LinkedIn, which I will put on the website on for you to see. So it's right here. You can also, and I recommend going to curated.health so you can see more about the type of curation he's doing. You can find him on Twitter at Farm in Innov, is I guess for innovation.
Yeah.
And then finally, he does his books coming out, like I mentioned. So that's another place you can go find out more about his book. So Hisham, thank you so much. Sorry, I had to get some of that stuff out there so that we can at least get into the conversation. But I don't even know how you deal with the fact that you are in beautiful Zurich today. Today is a cold day here in Delaware, and you are enjoying a beautiful warm day the last couple of days in Zurich. So welcome. Thank you for being here.
Thank you for having me.
So Hisham, let's talk a little bit about just your role. One of the things you define yourself doing is you're focused on social impact. What does that even mean?
Um, I hope that everyone within whether it's Takeda or any organization, you have this focus. We're all driven by purpose.
Hmm.
So I don't have in my job description focus on social impact, but that's what drives me, the purpose of having something that is meaningful, that will impact whether it's a patient, caregiver, uh, our colleagues or anyone in our society. Yeah. So and I think that's especially after COVID, we quickly realized that you know how important to have a meaning in our job, and how
Right.
important to see the impact our job is having, whether it's internally or externally.
Right.
So that's how I put it.
So I think I agree with you 100%, but I think there are different people with different levels of impact, and not because they don't want to have the impact, but because of the way because of the way they want to have the impact. So an example of that would be I think of clinicians or doctors as having an impact one patient at a time. On the other hand, I think of, say, population scientists having an impact on multiple patients, but no individual patients. So when you say you want to have a social impact, is it about the one patient or the many?
Uh, I think, uh, at least from my point of view, no one on itself can have an impact on one patient or many on its own. I think there's an element of collaborative approach.
Okay.
And so when we design, for instance, solutions for patient or for HCP, we always look to that. We are all driven, for instance, in Takeda with what we call PTRB principles. If I can name them, it's patient, trust, reputation, business. And anytime we do something, whether it's making a decision or acting on or doing an activity, we always ask ourselves 4 questions. This a solution or project or activity has a positive impact on patient health outcome? Then the second question, does it help build trust with the society? Does it strengthen our reputation with the society? And at the end, does it have a business impact? And
Right.
by business impact, it's not the P&L or the profit. It's how this can be sustainable over time. And every time someone within the organization is struggling to say whether it's a good or bad decision, they have to ask themselves those four questions. And the
Very
questions
interesting.
needs to go in sequence: patient first, trust, reputation, and business. Business last. So now, if I'm working with my team on a solution, we always look this kind of almost like a framework in our mind. Now it's almost like a part of our automatism, if I can say that, and we look at that. So if we design a solution, does it have impact on patient? But also, it's not only that. You need to also look what value this generate beyond patient, because if you create an impact with patient, but it creates more burnout or burden at the healthcare professional, it won't be adopted and you won't
Mhm.
buy in. If it creates an impact, it is well accepted by a physician, but it's not sustainable. That's another thing that you need to look at. So yeah,
So in your model, just so I'm following along, do the healthcare professionals fall under their reputation, the business, or is that part of that patient ecosystem you're referring to?
I think it's part of the patient ecosystem. If you think about layers, there's a patient, then around the patient you have the caregiver, then you have the family doctor, then you have the larger healthcare professional community. And I do believe then yes, you can apply human-centered design, but not only for patient. You have to take into account the whole ecosystem around it. Some some not to be too theoretical, but I always try to make a distinction with my team between patient-centered and patient-centric also. At
And I
least in
don't
my
have to
mind,
follow. Repeat that for me. Patient-centric or what?
patient-centered versus patient-centric.
Ah,
You
okay.
know, I'm not a big advocate of patient-centered approach because I believe that it makes patients somehow passive, and
Okay.
we adopt this paternalistic approach that we know what is good for you. I rather think about patient-centric, where patients are at the table. They are part of the co-creation process, and they are part of the conversation. And if you adopt just this mindset of shifting from patient-centric to patient-centric, the impact is huge. But also, you start thinking about, you know, using the patient as an important asset in designing or launching or maintaining those solutions once they are in front of them.
So it's what I hear you saying is when you talk about patient-centered, you're really talking about a passive approach versus that active approach you're defining before. Um, One of the things that pharma has done over the last few years, and in the U.S., for example, we have to deal with OIG issues and we have to deal with compliance issues, but it's to try to impact the patients and move towards this patient-centric model. But as part of that, we've also found ourselves going more to other healthcare professionals. Do you think that takes away from being patient-centric, or do you think it creates a fuller ecosystem?
I think it's the latter. It creates a full ecosystem,
Okay.
and it's more sustainable over time.
Okay.
Yeah, and a pharma, I think last 10 years they did a lot of effort, whether it's within Takeda or outside. The simple one, before when you design clinical trial, you don't involve patient before.
Right. Right.
Now you start asking patient, and you design clinical trial, and you design patient experience in the clinical trial. You listen to what matters to them, and when you design your target product profile, you take that into account. You also talk to payer,
Right.
which early in the process, it didn't happen before last 10 years, like I would say 10 years ago. It didn't
Yeah.
happen. You design a trial and what you have in mind is regulatory and an FDA approval. But now you start
Right.
thinking, okay, how this will impact patient life? How, what are the endpoint I need to look at? Not only to secure my authorization, but also to make sure that it has a maximum health outcome for patient.
Which I think is true, but I think it's one of those things right now, honestly, where I think a lot of talk is given in that direction. But at a practical level, when I actually see the protocols that come out from sponsors, you still see people using those templates, the same templates that were used 10 years ago. They're minor modifications, but I thought that as we start going to a more patient-centric approach, there would be more of that engagement. And I've been following this space for over half a decade at this point. And it's not to say that there hasn't been progress. It's just not been as dramatic as I would have thought.
Yeah.
So,
Uh,
so my question is, why do you think that is, and how do we fix it?
you know, maybe we can jump afterward to why I'm writing this book, because that's one of the reason. I put 2050 because I realized that healthcare and life science industry are really slow in terms of changing. And every time I like to say, there's not one pharma, there's not one healthcare entity. It's different, and you will have some pharma that are well advanced in terms of patient centricity and it's embedded, and others they are still using the old way. And I think it would take some time. It's a highly regulated, risk-averse industry, and I think those changes sometimes are scary. And
Yeah,
sometimes you want to make sure you do them right, because you said it. It's a very hard to engage with patient, you know, within while being compliant. So you have
right.
to be careful when you do that and not send the wrong signal. So I think there are different constraints, but if you look to the signposts, we are going this direction. Um,
I agree. I think we are going in this direction, and quite honestly, even from a regulatory standpoint, you are seeing that. I mean, the EMA has gone out of its way to, for example, make the results of clinical trials more accessible. Whether you're talking about patient lay summaries, whether you're talking about making data more transparent, et cetera, et cetera, et cetera. Providing the actual results of the summaries from like CT.gov and the like. Obviously, that's not EU, but the EU has its own version of it. But my question to you is that, do you think to really get to true patient centricity, we're going to need more regulatory enforcement of that patient centricity? Or is that something that as an industry we can cause?
I don't think that it's a matter of regulation. I think it's a matter
Okay.
of culture.
Mm,
You know, because patient centered is not a process; it's a
right.
state of mind. Uh, I talked about the PTRB principle. They're not only for a clinical development team or R&D team. It's everywhere. And
Right.
even HR person, doing some transaction work in the back office needs to
Hmm.
be patient-centric. And I'm not only talking about being patient-centric, but also being customer-centric and
Yeah.
being. So I always like to say that there are three experiences that any company needs to look at in pharma. There is the patient experience, there is the customer experience, whether it's payer, provider, uh, and there's the employee experience, and they need to all work together. So I don't think
Yes.
it's a matter of regulation or process. It's a culture, and it's how the ways of working, how you measure performance, how you incentivize the desired behavior. For instance, make sure that you involve the patient voice when you design a clinical trial,
Yeah.
a campaign, an information leaflet, anything. You know, I believe this is something that should be embedded and baked in the culture of the organization.
So I would agree with you, but let me give you the dark side of this story. Patients don't know what they're talking about. Every patient's different. Every patient wants something different. We can't incorporate all of it. It costs too much. It delays timelines. We're still early in the process. We can't afford it. Maybe for the second product that we come out with, et cetera, et cetera, et cetera. What do you say to those startups, to those mid-sized companies who are, in their eyes, trying to survive and grow, and might say someone like Takeda is a mature company that has the resources in place to address patient centricity, and they're just too early.
So again, I think patient centered doesn't mean that you are asking every patient, or customer centered that you are asking every customers,
Yeah.
but rather making sure that you elevate their voice. And
Mm,
and you have ways, for instance, to collect patient input. If you're truly interested, there are patient advocacy groups. you know that's one medium. I mean, there's no way you can talk to all the patient, and sometimes you're not allowed to talk to patient directly, but you can use mediums like that to collect insight and make sure. you know I think if you go to any patient advocate and say, I am interested to hear your voice about this new asset, we're developing new therapy, you will hear their voice and they will tell you what they're looking for, the expectation. And to this startup, I would say, your raison d'être, I don't know if you said in English, but
Yeah.
why you're here, your purpose is to serve patient. And if
Yeah.
you don't have time to listen to them, then maybe you should do something else.
I 100% see what you're saying, which is I think your argument is that there people are so focused on bringing it to the next product, they're forgetting, as you pointed out, the social impact, the PTR, what do you call it, the PTRB? No, I forget how you pronounce
So
it.
patient trust reputation business,
Correct.
PTRB.
Oh, it's
Uh,
just pronounced. Oh, it's just pronounced PTRB. Okay, I didn't know if there's a nice way of summarizing, but I love that. So you keep going back to that patient trust reputation business, and that's going to guide the process.
And even beyond that, I mean, if you look to our pillars today, we have 4 Ps. One is patient, one is what we call providers, the basic healthcare professional, because they are critical for us,
Yeah.
for patient. I mean, you cannot serve a patient without making sure that all the relevant HCPs and other healthcare professionals are part of the process. The third one, it's people, are employees, because that's critical. I mean, that's the big, and the fourth one is planet. And I mean, you as a company today, whether it's Takeda or any pharma, the planet itself, the environment, the impact you have on society, it's critical now. And you cannot just say, my solely focus is to develop drugs and serve patients. No, your solely focus is to develop drug, improve the future of well-being and health of patient, but also make it sustainable.
I'm going to add a fifth people for you, by the way.
I'm listening.
Payers.
Who?
Payers.
They are part of the provider P. Yeah.
Oh, you're going to put that into providers. Okay, that's cheating, but fine, whatever. No.
No, they are critical. I mean, they are critical, and and
Absolutely.
and and, and I like to say that payers, they are not customers; they are partners.
Great. Ooh, partners. I like that. Sixth P. Fair enough. So you're involved in innovation. You're writing the book on the next generation of innovation. So talk to me a little bit about some of the exciting things you're seeing in innovation. Obviously, we don't need to get into details. And just to be clear, this is only Hisham's perspective, does not represent Takeda's perspective in any way. But in general, what are some exciting things you're seeing in innovation over the next 20 years? And what is the crux? Is that the basis for the book you're writing?
Yeah, I would happy to talk. Yeah, I mean, there's a huge movement now on digital health, right?
Right.
I strongly believe that we're looking to the wrong part or wrong side. I don't think that digital health will be the one that will transform everything. I believe there are some exciting technology, and they don't have the hype that we have today with digital health in general. I give an example: mRNA platform. It has a huge impact not only for vaccines, whether it's for COVID or others, but it has a potential to change the way we cure disease or even prevent this cancer, for instance. That's one thing that I'm really excited about in the next coming, I said next decade. Another technology that I'm super excited is cell and gene therapy. I mean, those will completely change the way we deliver care. And if you ask me which one you're more excited, I would say those two first. The third one, of course, AI will have a huge impact. But I see AI as being a combination with other technology platform. For instance, AI with cell and gene therapy, or
Right.
AI with um, with 3D printing of organs.
Mm-hmm.
You start thinking about how maybe in 10 years we'll reverse some of those diseases.
Yeah.
You know, maybe not 10 years, maybe 20 years, but we can already today print liver. We can print a kidney.
Yeah.
Imagine the possibilities in 10 years from now.
I 100% hear you. And I think what's interesting about those technologies is how they will, to your point, increase patient trust. It will increase the reputation of the industry to go from, in the US at least, being more money grubbing to really saving and completely changing patient lives and impacting the planet. But yeah.
Yeah, yes, actually, in the book, I was talking about prevention.
Hmm.
I was always exploring the concept of precision public health.
Hmm.
How can you apply the concept of precision medicine to prevention? Can you, for instance, instead of having a prevention that will tackle everyone, to start targeting subpopulation, and
Mm.
and then target very precise preventive intervention? Why I'm talking about that, because I believe that if we want to have a better future for health, we should really focus on how prevention would do that. So rather than say, I have now someone with a particular disease, can I prevent it early in the process? Can 2050, if I think about 2050, it's our kids. You know, if there's a teenager today, in 2050, it's like mid 40s, mid 50s between.
Yeah.
It
Yeah.
means that those people are the one who would enter in the healthcare system. So how can we reduce the demand side now? And how that's one question I'm trying to cover. Another, you talked about planet. One of the chapter I want to cover is called treating patient earth, because we see a strong correlation between the environment and health. And uh, if I take just one statistic, I was looking to the impact of pollution and lung diseases. In 2050, we'd have 6 to 10 million people dying from lung disease related to pollution. This is something we should tackle. Antibiotic resistance. There are studies show that we'll have 10 million people dying every year in 2050 for antibiotic resistance. So I think there's an element of trust, but also there's an element of what can we do now to have a healthcare system that will, one, meet the demand, but also reduce the waste we have today in the healthcare system. I mean, everyone likes to talk about pharma. Pharma is just less than 10% of the cost today.
Yeah.
Mm.
But I'm thinking about a lot of the stuff you're saying, and I'm trying to what you sort of pointed out was, what does 2050 look like? One of the things I think 2050 is going to include that dramatically changes the list you have in front of me, which I think is a really good list, is I think that we will have made progress in anti-aging therapy. And there's a whole movement, as you know, where they say that aging is not a condition, it's a disease. So there are people, as you know, who are trying to cure that right now. The question is, if we do actually manage to make impact in the area of anti-aging, what impact does that have on, for example, antimicrobial resistance? Because you might now see that your T cells and B cells can suddenly fight better. You might have your pollution. Your cells are just able to regenerate faster and address a lot of these questions. But do you think that there are these transformative technologies that will change your list so quickly that are seeping at the sides?
So there is one truth and one constant, is that no one can predict 2050. We can look
Yes.
to different possibilities, but I'm looking to aging. I mean longevity.
Yeah.
So here are some issues I was looking when I was looking at this particular topic for 2050. First, let's look to demographic.
Okay.
In 2050, you would have more people over 65 than people less than 14.
Sure. Oh, interesting. I didn't know that actually. Interesting.
Interesting, huh? You will have a billion to a billion and a half of people that are over 75. You will have, today we have 10 people on average working for every person who retired. In
I'm
2050, we'll
I,
have only five.
I'm going to challenge you on that. By the way, the numbers, they're based on this idea that we'll survive that. If what you're saying is true between antimicrobial resistance and pollution, wouldn't most of those people? I mean, I'm including myself in there. We'd be dead by then,
I don't
just
think
based
so
on
would
the
be that.
no.
Actually, in one part I
Okay.
was exploring, so I'm exploring two scenarios, one is dystopian and one utopian. And I was saying that between those two extreme, there are possibilities where we will land. I don't
Yeah.
think we will disappear. No, no. Unless we have a virus that is coming from our permafrost because of climate change and
Right.
who knows,
Right.
or a big asteroid that will hit us. But uh, I don't know. No one can predict that. What I'm
Right.
trying to tell you is that with aging, there are two problems I see. The first
Okay.
problem is that you will have more elderly population who's going to take care of them, whether paying the pension,
Yeah.
you know. And the second thing is that while we age, the question is, will we age healthier,
Right.
healthy aging? The problem is that with aging, you will have, maybe you will discover new non-communicable disease. like cognitive impairment. Today,
Yeah.
I was looking to statistics for Alzheimer, for instance, we will triple the number of Alzheimer cases in 2050 compared to today. You know, so there are maybe diseases we have no idea that are existing, but because we're aging, even
Right.
if we have regenerative, we might have those diseases in the future. And those are the questions that also, while we're looking for longevity, we have to also look to social impact in terms of who is going to take care of those elderly population, but also maybe new disease that will come.
Yeah. Incredible. We can have a whole discussion on just anti-aging. And it sounds like we probably should have a whole discussion on anti-aging therapies and the impact and what your book's going to talk about. So I do want to actually, we're well past time, and we can, it's so much fun to talking with someone like you. A couple of different things before we get going. Could you talk a little bit about Curated Health?
Yeah, sure. I mean, Curate Health, it's a not-for-profit platform. So the idea was to create a place where people like you, actually, or like me, or who are curious, basically to recommend content. Why I launched it? Because I was frustrated with LinkedIn and Twitter. It's just a mess. And I say, is there a way to create a community of people who are willing to share and recommend readings? It's like the good read,
Right.
if I may, but for articles, podcasts, video, and so on, for the knowledge. And
Right.
and and that's the dream, is to create a platform where really the knowledge is available, it's created for everyone. It's to democratize the access to curated knowledge, if I may say. And it's not only digital health, it's health and technology. So could be like something on precision medicine, cell and gene therapy, or something in artificial intelligence, robotics, and so on.
Which takes us to your book. Could you talk a little bit about the book that's coming out?
Yeah, so the book, uh, it, it covers the 2050. And one thing that I'm trying to cover in the book first is that no one can predict the future. But what I have realized is that most of the books that I've read on this on future of health, there are two things that I strongly disagree with. One is that they look to future in singular, and I
Okay.
doubt that someone can predict what will happen 30 years from now. And the second, they're most of the time techno optimist.
Mm,
So
mm,
so I am optimist, but I believe that if you want to tackle the future of health, you need to answer another question: which society will be having in 2050? Is it a society where government are strong, or you have a failing state? Is it a society where you would have convergence of wealth, or a completely divergence of wealth? Those are the questions we need to tackle. So which society will be living in 2050? And this also leads to another question. You cannot predict the future of society without looking at our environment and the planet, our spaceship. And if I look to the scenarios for 2050, they are scary. And if we land on +3 or +4 degree, even if we improve our medical technology, if we advance, the society will not be at the place where all this technology can be accessible to everyone. You talked
right.
about the fact that technology will improve, like aging, adapted. Someone in Africa will benefit from anti-aging technology. Maybe it will be the 1% of people who can afford it. And
Right.
I'm looking to the different pieces. One, it's how prevention will be done in 2050, and what should we be doing now to make sure that we don't have a lot of people hitting the healthcare system 2050. The
Right.
second one is what will how the personalized care will be delivered. I mean, everyone's talking about that, but I'm trying to imagine to the extreme how it will be performed in 2050. Another one is, will everyone is talking about the end of this season 2050. Is it true? So I'm trying to explore also this question, but also there are other questions related, for instance, how to make an open system where innovation, whether it's medicine or non-medicine innovation, is more accessible to everyone, more equitable. And what are the implications, the ethical implication also? I mean, uh, I don't know if we still have time. One of the scenarios I'm exploring is that in 2050, everyone will have a twin, but who will own the twin? Who will appropriate the replica of yourself? I mean, those are the questions we need to tackle now to have a future we desire for in 2050.
It's such. I mean, we can have a whole conversation about digital twins, and we can have. I mean, each of the topics you pick are things I care about, things I've researched into. So, absolutely more than happy to talk about. In fact, yesterday's news that Robert Califf is now FDA commissioner in the U.S. The big question, he came from Verily. So the question is, he's now going to be a person who is focused on data
I
because
have seen that
that's his
post. Yeah,
background. So the
yeah.
question is the digital twin closer today than they were yesterday? And I think I would argue to your point, yes. I mean, I worked for a company. I can talk about this. Who is a leader in the digital twin technology space? I worked for Synchrogenics, which is part of Certara, and Certara builds a lot of the technology in the data space. So I would imagine that they would have an impact. So I've had some closer front, maybe not front row seats, but I've had sort of mid row seats to some of those conversations. So I find it fascinating. I think it's incredible. I can't wait to talk to you about each one of these and build up to it.
What I
So
can tell you,
yeah.
what
Mhm.
I can tell you actually, the beauty of writing a book is that you go with a mind you don't know. And because more I read or more I talk to people, more I realize I don't know much. And I think it's a learning journey. I mean, digital twin. Every question I raise, they are experts in the field today,
Yeah.
and there's no way you can keep up with the level of knowledge and expertise they have today.
Right.
Um, and I would be happy to talk to the company you mentioned now. Well,
But we'll oh, I don't work for them anymore, so I don't have very limited pull there. But such a great conversation. Such I love also that in the book you're not talking about just being a techno optimist, and everyone talks about how 2050 is going to be amazing, and you're like, could be, it could very well be amazing, or things could go completely wrong. And what
yeah,
does that wrong look like?
yeah.
Is it more like a Mad Max situation where technology has completely broken down? I think that's a little too pessimistic,
Uh,
uh, but there's a gap between what's expected and what's possible.
Yeah, I mean, technology by definition is neutral. It's how we will use it, and I agree with you. I agree with you. But I'm very optimistic for 2050. Not completely techno optimist, but optimistic.
Uh, I have no choice but to be optimistic. The option of being pessimistic just seems too depressing for me.
No,
This was wonderful having you on. One quick thing: how can people reach you? What's the best way for people to reach you?
I mean via LinkedIn, via my email. And just I'm sorry if I'm not really responsive on LinkedIn. Sometimes my mailbox is a bit of a mess. Uh, but I try always to reply to the messages. Yeah, and please join Curated Health. We need more people to help deliver on this mission of spreading knowledge in health and technology.
Wonderful. And thank you again for coming on. Any last words?
Uh, Thank you. Keep up with this great job, and really it's the people like you that will improve the level and the quality of conversation within our field, and we need more of you people. And also, you are a connector within different fields. And unfortunately, I see more and more silos approach. Everyone is working in one specific technology, but we need people like you to connect the dot also.
I appreciate it. You're very kind, and I actually want to talk to you about connecting dots because that is the huge future no one's talking about, which is how do you create an ecosystem? And there's just not enough conversation about that. Everyone wants to do the one thing that gets them forward. What they
Yeah,
realize, what most people forget, is you can't move forward unless society moves with you. So
yeah,
how do you create that ecosystem? Because if you're too far ahead, people can't invest in you because you don't see the returns.
agree.
So it's going to be a great conversation. So thank you again for coming on. Can't wait to
Thank
have
you.
you back again.